Hello, my name is Jim, and I'm a lab technician at the Center for TMJ and Sleep Apnea, Dr. Larry Pribble's office. And today, in this video, I'd like to talk to you about an oral sleep appliance called the Respire, and how to go about adjusting that appliance. The important thing to know before adjusting any sleep appliance is you only do so if you are still having apnea events at night, if you're snoring at night, if you wake up and are drowsy, or if you have daytime sleepiness. And most importantly, if your doctor recommends that you adjust it. You never make adjustments on your own without a doctor's recommendation. And every adjustment to a sleep appliance is very small in increments, because how we go about treating sleep apnea with the oral appliances is that it takes your lower jaw and moves it forward to open the airway and allow more air into the lungs. And if we make adjustments to the appliances too fast, it could push your jaw too far forward, and you can create a joint problem and have joint pain. So be very careful with how you make your adjustments. But we'll get into this certain appliance here. Once again, it's called the Respire, and it is two pieces, an upper and a lower. It's custom made to fit one person, fit their teeth. And how it works is the upper appliance closes into the lower, and there is an expansion screw on the bottom of part of the appliance, and that pushes this fin back, which would contact the upper one sooner and sooner as it goes backwards. And the earlier it contacts it, the more it is going to push your lower jaw forward. And how you adjust it, if you're still having apnea events and you know it's time to make an adjustment, the keyhole is right there in the lower part of the appliance, the key mechanism. And this is probably going to be very hard to see on the video, but there's a arrow that points down on this side and points up on this side. How you hold the appliance doesn't really matter when you're making the adjustments, as long as you know to turn with the arrow. So here the arrow is pointing down, so you take a key and you place it in the keyhole, and you just make one turn with the arrow there. And one turn, just one small turn with the arrow there, is 1/10 of a millimeter. So it'll take 10 turns to move it 1 millimeter. And this appliance has the capability to move your jaw out 6 millimeters. So that means there's about 60 turns built into this appliance before you max it out. So that's a decent amount of room to try to find the patient's optimal position to where it decreases their apnea or eliminates their apnea. And so one important thing to note for sleep technicians is if a patient comes to get a sleep study done and they have one of these appliances, we're going to want them to titrate the appliance to try to find that patient's best position. So the patient will bring with them a sleep protocol. It's a piece of paper that tells the sleep technician how and when to adjust this appliance, how to go about it, and how many turns we want them to do in an hour or a couple hours times throughout the night, to try to find the best setting for that patient during their sleep study. And that lets us know after the sleep study where the patient should be and how to go ahead using this to manage their sleep apnea. So this is the Respire. It is an FDA approved sleep appliance, and that is how you go about adjusting it. Thank you for watching this video.